From my own experience, through my Beyond Zero initiative, I have added my voice and championed initiatives that are central to removing structural barriers and to ensure that no one is left behind. The Beyond Zero's clarion call that no woman shall die while giving life amplifies this. The core of the initiative's ideology is to complement existing global and national health sector plans, to inspire action by political leaders, partners, and communities, to accelerate and catalyze change. Our work has required focus in messaging and inclusivity of all stakeholders, public and private sector, the national and county governments, NGOs, and the media. Female genital mutilation is recognized as a violation of human rights and has been outlawed since 2011. As a result, we have witnessed a considerable decline in many parts of Kenya. However, new emerging practices have necessitated strengthening policy to address the rapidly changing way FGM is performed now, targeting newborn girls and married women. Ladies and gentlemen, social protection is a key point that, in my view, is critical if we're to accelerate gains for the development of our countries, as well as contributing to the African Union Agenda 2063 on gender equality. We need to reflect on what we can do to leverage our strategic positions to enhance women's access to income and healthcare. The importance of ensuring inclusive healthcare is critical in reversing mortality and morbidity rates. And gains have already been seen in Kenya in its pursuit of universal health coverage. Notably is the reduction in maternal deaths from 698 in 1994 to 362 per 100,000 live births today, and reduced child deaths from 96 in 1994 to 52 per 1,000 live births in 2014. HIV prevalence was at a high of 10.5% in 1996, and today we have seen significant decline in adult HIV incidents. However, we're experiencing an upsurge of new infections in adolescents, with girls and young women being the most affected. Empowerment is critical for women and young girls to make meaningful contribution to our economies. Over the years, Kenya has put in place legal and policy frameworks in line with the ICPD platform for action and the Beijing Declaration to advance gender equality, equity, the empowerment of women, and the elimination of all kinds of violence against women. Kenya's Vision 2030 and the Bill of Rights in Kenya's Constitution both highlight affirmative actions and policies and programs. The Constitution also proposes the enactment of laws to enhance equality and non-discrimination. This has created a conducive environment to nurture and propel many more women into leadership roles at all levels.
So let us first acknowledge that the structural, social, religious, and cultural barriers and stereotypes, lack of resources, and sometimes skills constrain them from actively participating in leadership. And for that, we must ask ourselves what can be done to place women's leadership at the heart of the transformative global agenda. I believe that a lot is needed before we can even think that this is achievable.
Why is it that the joints that sell alcohol and drugs are much more welcoming to adolescents than healthcare posts are? Why is it easier? Why is it easier for our leaders to fly abroad to access better healthcare than it is for them to invest in improving the healthcare systems in our respective countries? Why is it that our justice system continuously fails victims and survivors of gender-based violence, which is highly prevalent in the region? I mean, right now in my country, you can walk around the streets and you see rapists and murderers. But stock theft, if you steal a car in Botswana, you are in jail the next day. But people are beating and killing women and girls, but they're not being jailed. And these are the questions we need to ask ourselves. Many countries today, especially in Africa, have criminalized FGM, but the prevalence is increasing. So the issue is no longer just legislation, it is now the political and technocratic will to enforce and implement.
Our interactive dialogue, and if Jessica is able to join.
Environments like I do, where it's very, very difficult to talk about how to get much more strategic. I think what I want to say about transformative change, living with HIV, taught me that if we don't
commitments of champion countries and champion private sector organizations and NGOs, and all international tools, treaties, and conventions cite women leaders of all age and all walks of.
Dr. Kanam is recognized for her leadership. It's my privilege, Dr. Kanam, to invite you to give us your